Let's start with the most brutal and move towards the most life-threatening medical procedures ever. Number 8. Trephination. Andes? Circa 7000 BCE. In ancient medicine, head injuries and seizures were sometimes treated by relieving pressure in the skull, a practice called trephination. Evidence from the Andean highlands of present-day Peru shows that healers scraped circular openings into the skull to release pressure or spirits. Patients were restrained on mats while the healer worked slowly with stone tools. There was no anesthesia or antiseptic protection, making infection and blood loss major risks. Despite this, many survived. Skulls with smooth, healed edges have been found across South America, Europe, and Africa. Trephination likely relieved pressure from swelling or hematomas, even if the underlying cause was unknown. Centuries later, Hippocrates prescribed trephination after skull fractures to reduce brain swelling and fluid buildup. Modern neurosurgery still opens the skull to relieve pressure, now using imaging, sterile instruments, and anesthesia, following the same principle. Number 7. Robert Liston, London, 1846. Before anesthesia, surgical speed was critical to reduce pain and shock. Scottish surgeon Robert Liston at University College Hospital in London became famous for completing amputations in under 2 minutes using knives, forceps, and a bone saw. One notable case involved an above-knee amputation in 1846. Liston's speed minimized pain, though blood splattered across the theater, and an assistant was accidentally cut. Later that year, Liston demonstrated ether anesthesia publicly, signaling a shift from speed-focused surgery to safer, pain-managed operations. His approach combined rapid technique with careful anatomical knowledge, influencing surgical training during the transition to anesthetic surgery. Liston's fame highlights both the danger of pre-anesthetic surgery and the importance of skilled, decisive technique. Number 6. Symphysiotomy. Ireland, 1940s-1980s. In obstetrics, obstructed labor sometimes required a surgical solution, leading to symphysiotomy. Between the 1940s and 1980s, Irish hospitals performed the procedure by cutting the pubic symphysis to widen the birth canal. The procedure was often done without proper anesthesia or informed consent. While some infants survived, mothers often suffered chronic pelvic pain, difficulty walking, and permanent pelvic instability. Hospital records show symphysiotomy persisted for decades despite the availability of safer cesarean sections. Eventually, cesarean sections replaced symphysiotomy, improving outcomes for both mothers and babies. Number 5. Cataract Couching. India and Middle East, 1700s. Cataract couching was an early method to restore vision by displacing the cloudy lens rather than removing it. In northern India during the 1700s, surgeons inserted a sharp needle into the eye to push the lens downward. The procedure required no anesthesia and was fast, making it useful in rural or low-resource areas. Some patients temporarily regained partial vision, but many developed infection or permanent blindness. Displaced lenses often caused ongoing pain and distorted vision. Couching spread across India, the Middle East, and Europe because it was simple, portable, and quick. Surgeons documented techniques in eye anatomy, gradually improving ophthalmology knowledge. By the 19th and 20th centuries, lens extraction and implants replaced couching, allowing safer, predictable vision restoration. Number 4. Bloodletting, Philadelphia, 1799. Bloodletting was an ancient treatment based on the belief that illness came from imbalanced bodily fluids. In 1799, George Washington developed a severe throat infection, and doctors removed roughly 2.5 liters of blood over several hours. The patient became weak and pale. Bloodletting worsened his condition, leading to death the next day. The practice had been widespread for centuries for fevers, infections, and mental illness. Physicians used knives, lancets, and leeches, believing it restored balance, but excessive removal often caused harm. Washington's case illustrates the limits of 18th century medical understanding. Later, evidence showed excessive blood loss increased mortality. Bloodletting declined as evidence-based medicine, IV fluids, and antibiotics replaced it. Number 3. Mercury and lead treatments. Vienna, early 1800s. In historical medicine, toxic metals were used as remedies despite their harmful effects. In early 19th century Vienna, Ludwig von Beethoven suffered digestive issues and hearing loss. Doctors prescribed mercury compounds orally and lead-based ointments for skin conditions. These substances accumulated in the body, causing tremors, mouth sores, digestive problems, and worsening neurological symptoms. Analysis of his remains revealed extremely high mercury and lead levels. Metal treatments were common in Europe before pharmacology developed. Eventually, heavy metal remedies were replaced by safer, controlled medications. Beethoven's case highlights the dangers of toxic medicine and the importance of empirical testing. Number 2. Lobotomy, United States, 1941. Lobotomy was an early psychiatric surgery that severed brain connections to treat mental illness. In 1941, Rosemary Kennedy underwent a frontal lobe lobotomy for behavioral changes and perceived emotional instability. Surgeons inserted an ice pick-like instrument through the eye socket to sever frontal lobe connections. The procedure was quick and required minimal equipment. Afterward, Rosemary lost independence, her speech was limited, and her emotional expression flattened. Lobotomy, developed by Antonio Egas Moniz and popularized by Walter Freeman, spread rapidly due to simplicity and lack of alternatives. The procedure declined after psychiatric medications, imaging and ethics allowed safer treatments. Lobotomy illustrates the consequences of surgical intervention without understanding long-term effects. Number 1. Animal-to-human blood transfusion. Europe, 1667. In the 17th century, physicians attempted to treat mental illness by transfusing animal blood into humans. In 1667, French physician Jean-Baptiste Denay transfused lamb's blood into a teenage boy, who survived because the volume was small. Later, Denay transfused lamb's blood into Antoine Marois. After multiple procedures, Marois had severe reactions and died. Although Denay was acquitted, public outrage led to legal restrictions. English physician Richard Lower conducted similar experiments with dogs and humans, helping understand transfusion compatibility. The practice declined by 1668 due to safety concerns and inconsistent outcomes. Transfusion medicine revived centuries later after Karl Landsteiner discovered ABO blood groups in 1901. This discovery allowed safe cross-matching, drastically reducing fatal reactions and laid the foundation for modern transfusions.